Well, hi there. I'm Dr. Jessica Evert, and I am the Medical Director for Palliative Care Services for Ancora Health Services. And I also work in our community in the St. Al's and St. Luke's Health System. It's really great to be here today to talk about my passion, which is palliative care.
Jessica, thank you so much for joining me today. And I would love it if you would just take a few minutes to share a little bit with our community about your business and the focus of your work.
Yeah, absolutely. So palliative care is a specialty of medicine, and I'm board certified in palliative care. I'm also a family physician and what we call a hospitalist, which is where we work in the hospital. And recently I have joined Ancora Health Services and offer home-based palliative care, which means I come to your home and do home visits with you or your loved one in order to provide palliative care. And I know that's a complicated word and people may or may not have heard of it. So maybe I'll give you a little bit of foundational information on what palliative care is. Palliative care is a type of medicine that helps people who have a severe diagnosis or disease, and we can help anytime from the time you're diagnosed through the stages of illness to the end stages of illness. And as a palliative care doctor, I focus on understanding and advocating for your quality of life, helping with symptom management, also helping you plan the type of healthcare you want in the future, or what we call advanced care planning, as well as navigating various decisions that may be in front of you in terms of what kind of medical treatments you want to receive and what the impacts of those will be. I journey with patients through their illness and really try to advocate for patients and family members being in the driver's seat of their care and their care plan.
Well, thank you so much for that really important description of what palliative care is and how it can benefit your patients and their families. So tell me, what do you enjoy most about the work that you do?
Oh, I enjoy so many things about it. I've been a doctor for almost 20 years, and I really enjoy the culmination of so many experiences I've had over decades, being able to benefit patients. So I think I have a strength at really looking at the big picture of what's going on, while also understanding a lot about the details of various diseases like cancer, congestive heart failure, COPD, lung disease, diabetes, high blood pressure, strokes. And because I've had so many longitudinal experiences with patients, I can really help you understand what life is likely to be like in the future and orient things around what's important to you. So I'm super passionate about being able to empower patients and navigate things, and also see both the forest and the trees in terms of what's going on in people's lives. I think oftentimes healthcare doesn't always present different options to patients. Sometimes you get on a train and that train just takes off. And in reality, there are many stations that we can stop at and pause and really reflect on what's most important, what you want the day-to-day to look like, and how to arrange healthcare around those goals.
That's wonderful. And what motivates you to do the work that you do? What brings you to work every day?
So I've had personal experiences. My mother passed away last year, actually, after a journey with cancer. And she had a lot of the ups and downs that cancer patients had. She eventually worked with palliative care on pain management and on advanced care planning. And subsequently, she was on hospice care. A lot of people confuse palliative care and hospice care. Palliative care is not for just end of life, whereas hospice care is for end of life. And so I find that a lot of patients think that if they have a palliative care specialist, they're going to lose access to treatments, or it's giving up, or it otherwise has a negative connotation. And so I think one of my passions is to clarify that and to recognize that palliative care can happen alongside all your other specialists. It doesn't mean you're giving anything up. It doesn't mean that you're throwing the towel in and you're at end of life. It just really means that having that palliative care doctor as part of your team helps bring greater clarity, better quality of life, and really peace of mind.
That's wonderful. So one more question for you today. Is there one piece of advice you would share with our community today as they consider their future in palliative care or with palliative care?
Yeah, I mean, I guess the advice is to just be open to these conversations. At Ancora Health Services, I'm able to come to your home and to do a visit, which is billed through insurance, just like any other doctor's visit. And we can even talk about if palliative care is a good addition for your healthcare team. So there's no commitment to engage in a long-term relationship, but just rather, I would advise people to be open to understanding how palliative care may help you. In addition, there may be doctors that are in our community and around the country that don't fully understand what palliative care is either. It's a newer specialty. And so I would just say that if you're encountering even doctors or other healthcare providers who are confused about what palliative care is or discouraging you to having those conversations, to have the courage to advocate for opening up that door and just learning more about how palliative care may help you or your loved ones who are facing severe disease, advancing illness, or advancing age.
Wow. Well, thank you so much for joining me today, for sharing your wisdom, and mostly for supporting our mission of helping people navigate the joys and challenges of aging and caregiving.
Absolutely. Thank you for having me.